Late Night Health continues. I'm Mark-Alyn. Robert Clancy will be joining us in 1 hour from now. If you don't get the second hour of Late Night Health, join us on iTunes, or you can go to latenighthealth.com to hear the show. Both hours of the show on iTunes now, and you can download and listen to us at any time you want. We go to Florida right now, and we visit with Sarah-Kovach. And Sarah is the therapist team lead at Lakeview Health, and we're going to talk about addiction recovery. Sarah, has there been an increase in addiction over the last number of years?
Absolutely. I would say a big piece of it is, people starting to openly discuss addiction. I think it's something that had a lot of stigma attached to it in the past. And so I hear, more and more people coming out and talking about it. You'll even see in the media, people admitting that they've struggled with addiction for many years. So I would say there definitely is an increase. There's also an increase in people being open about it. Wow.
Why is the openness? Why? I mean, we hear about it, but isn't it still something, he's an addict. We don't want to talk to him.
Sure, yeah, and I think, we still have a long way to go in challenging a lot of the stigma, associated with not only addiction, but mental health in general.
Right.
But I think the more and more people come out and start that conversation and start talking about it, the easier we're sort of able to dispel some of those myths.
What is the most important part of the addiction treatment process, in your opinion?
Sure. So, it's really important for us to address sort of the underlying issues, reasons that people are continuing to struggle with maintaining sobriety and recovery. So we believe in the disease model of addiction, meaning that people are biologically predisposed, to have these addictive qualities. But then there's also a lot of times other factors that are contributing. So we really think it's important to look at, the family system. Are there parts of the family system that are perpetuating some of this use? Is it part of the environment, needing to remove people from unhealthy lifestyles and environments?
With your training in psychology, and you have a master's degree in clinical mental health counseling,
correct.
Why did you decide to go into addiction recovery?
Sure. To be honest, I kind of fell into it. It was sort of something that I experimented with in my internship in college. Really found a passion for it. There's really a need for people understanding this population of people who I think for a very long time have been misunderstood. And that really kind of drew me to the field.
Do you believe that residential addiction treatment, which is what Lakeview Health specializes in, is important for recovery, to take the person out of the home, out of the environment, as you were just saying a few minutes ago?
With residential treatment, what we find is that we can do, essentially accelerated therapy. So the amount of therapy that you could get sort of in an outpatient setting on a weekly basis is something that could take weeks or months to be able to do that we, are able to complete in a week's time. The medical component's also really crucial. So being able to stabilize patients and get them the medical care that they need. A lot of times in addiction and active addiction, patients really are not taking care of just physical needs, not meeting with the doctors regularly. And so the medical component is also really important.
You specialize in the mental health aspect of this. Can you give us an overview, though, of the medical treatment?
Sure. So at Lakeview, for instance, we have 9 full-time physicians and physician's assistants and 45 full-time nurses. And so the medical component is really, really a big piece of what we do here. And so when patients come in, they are medically stabilized, so they go through the detoxification process, just ridding their bodies of all the toxins, all the drugs that they've been using. And then they'll continue meeting with the medical providers on a regular basis for, primary care concerns the whole time that they're in treatment.
Gotcha. And what is the average length of treatment? Is it a week? Is it a month? Or does it vary?
Yeah, good. So it is individualized. Right now, we're able to keep patients for anywhere between 6 and 9 weeks on average.
6 to 9 weeks. And during that time, they have intensive therapy as well as medical overview.
Absolutely. So group therapy is, one of the main modalities for treating addiction. And so heavily focused in group therapy, small groups. For instance, I run a group that has anywhere between 7 to 10 patients on my caseload who are meeting, 4 times a week for a pretty extensive amount of time. And then I'm also meeting with my patients individually. One thing that we think is really important is experiential therapy, meaning that really exposing patients to settings, external factors. For instance, I think last weekend they took the patients bowling, right? And then bringing them back on site and going through, what was that experience like for you? How would it have been if you were at home? What sort of triggers can we expect before we send you back home, just to really get patients prepared?
I'm really curious about this, Sarah. When was the last time you went bowling?
It's been a little while. It has been a little while.
It has been for me as well. How does that? I mean, I guess that's a normal activity. Okay,
sure.
It's a family activity. It's a social activity. Is that the purpose of that kind of a field trip?
Yeah. So you're right, and I get this question often. It's a matter of trying to get patients to explore different hobbies, things that maybe they haven't tried in so long. For instance, we'll get a lot of patients who are in their late teenage years, anywhere from 18, early 20s, who've never even experimented with any of these things. We've taken them ziplining or to pottery classes to start exploring some of these different hobbies. And so, yeah, it is. It's kind of explorative.
What about AA? Isn't that a treatment? We've talked about that off and on over the last couple of years here on Late Night Health. I'm proud to say that Daryl is a recovering alcoholic for almost 30 years now.
Yeah, just past 30.
Just past 30. Okay. Congratulations.
Thank you.
That's really great. Is that something that a recovering addict should consider?
Absolutely. So our program is heavily focused on the 12 steps. From the time patients are coming into treatment, I'm encouraging them to obtain a temporary sponsor. As a part of the treatment here, they go to a 12-step meeting every single night. And so they are getting heavy exposure to the 12 steps, to sponsorship, to meeting attendance.
And that depends on alcohol or drug abuse?
So there are AA meetings, Alcoholics Anonymous. There are also NA meetings, especially locally here. We have some Narcotics Anonymous meetings. And so we give patients the opportunity to choose whichever meeting they feel more comfortable with.
How does the Lakeview purview of recovery differ from some of the things that we see heavily advertised on TV that includes massage therapy, yoga, exercise? It looks like, frankly, I'd like to spend a month there. You've seen the ads as well.
Absolutely.
You know what I'm talking about.
Sure. Yeah, so, our program is really heavily focused on the cognitive behavioral approach to therapy. As I mentioned, the 12 steps are really integral, really important in our program. We do practice a wellness approach, and so holistic methods are important to us. Nothing like massage, like you're talking about, but we do have a wellness center where we encourage patients to learn about nutrition, learn about healthy living, get into an exercise routine. But all of that comes secondary to the therapeutic component, certainly.
And the issue of other mental illnesses that work in conjunction, if you will, with addiction. For example, somebody's bipolar. They may tend to abuse drugs. They may tend to use alcohol, overuse alcohol, and that's why they're there. Is that happen? Is that a common occurrence? Absolutely.
So we find that mental health issues, co-occur with addiction frequently. And so we treat both. It's really important to us that we're also assessing patients when they come in for symptoms of depression, for anxiety, for bipolar disorder, as you mentioned, because what we find is that if we only treat the addiction and leave out some of the other mental health pieces, we're not really treating the full person. So addiction has to be the primary disorder upon admission, but we're absolutely assessing for those and treating those as well.
And you also work with people who are suffering post-traumatic stress that may have triggered the addiction. How does that work?
Sure. So, in fact, that's one of the areas that I specialize in. So, I'm working on certification for EMDR right now, which stands for Eye Movement Desensitization and Reprocessing. Essentially, a therapy for patients who struggle with post-traumatic stress disorder. And we know that addiction co-occurs with PTSD, at a really high rate. So, we're definitely doing trauma therapy here. All of our clinicians are trauma informed, so they know how to be sensitive to trauma. We assess for it upon admission. Definitely something that we're aware of and working to treat.
So, in other words, if somebody has somebody dies, they're in an accident, maybe even coming back from a war as part of the military. These kinds of big episodic events in one's life can trigger an addiction?
No, I wouldn't say can trigger an addiction. What we will see is that, people who go through trauma could go through a period of abusing drugs or alcohol as sort of an unhealthy means of coping. But again, we believe in the disease model of addiction, meaning that, it's a genetic predisposition. And so oftentimes people will start abusing those substances during that time and could, go on to develop a dependency. But I don't believe that trauma directly causes addiction.
But if somebody is predisposed to it, it could.
Certainly. Absolutely.
Right. Tell us more about EMDR. What is that?
Sure. So, like I said, it's a trauma therapy. Really what it does is help people to reprocess traumatic memories. So, for instance, imagine you and I both witness a natural disaster. One of us may go on to sort of develop healthy coping mechanisms, and so we both may be a little bit distressed immediately after. But then maybe one of us goes on to have, some of these what we call post-traumatic symptoms. And so some of these trauma symptoms are really lingering and lasting a lot longer than average. And so what this therapy does, using eye movements, so it uses a finger movement in front of the eyes to stimulate the eyes going back and forth, helps people to reprocess memories so that they're essentially not as distressing.
Wow.
Mm-hmm. It's incredible.
It really is. You're getting certified in that. Have you had it yourself? Can anybody use that to make their life better?
Sure. Anyone could seek EMDR treatment. So I have been trained in the therapy, and to be trained, you have to do, the clinicians sort of practice on each other as a way of sort of learning to do it. And so to be trained means that you can practice it and use it. I use it here at Lakeview, in fact, but to be certified is sort of just an extra sort of layer of
it's good accountability. From Lakeview Health in Florida, sarah-kovach is our guest. She's the therapist team lead. We're going to take a time out. When we come back, we'll continue our conversation with Sarah. I'm mark-alyn. This is Late Night Health. Join us at latenighthealth.com, and you can go to itunes.com now to listen to us anytime you want. Can you imagine, Daryl? They can listen to us with their iPad under their pillows.
A bonus at no additional cost.
And no additional cost. All right, more coming up. Don't go away. Late Night Health continues.
You're listening to Late Night Health with Mark-Alyn. The show continues in a moment.